What if I told you that some of the most common things stroke survivors do in recovery may actually be slowing their progress? As a neurologic physical therapist, I work with stroke survivors every single week. Some make incredible gains months or even years after their stroke. Others can feel stuck, frustrated, or convinced that they've plateaued. The difference is often not in motivation, age, or even how severe the stroke was. It's understanding how the brain actually recovers. Today, I'm sharing 5 of the biggest stroke recovery mistakes that I see, and more importantly, what to do instead. If you are a stroke survivor hoping to improve your walking, arm function, balance, confidence, or independence, this video could completely impact how you approach recovery. Hi, I'm Dr. Arryn Gamble, a board-certified neurologic physical therapist. Before we jump in, I want to make sure that one thing is clear. Every stroke is completely different. The recommendations in this video are based on what we know from stroke rehabilitation research and neuroplasticity. But recovery should always be individualized to your specific goals, your impairments, and medical history. If you're looking for personalized guidance, I do work with stroke survivors virtually through my online coaching program. So whether you don't have access to a neurologic specialist near you, travel is difficult, or you've been discharged from therapy but still want to keep improving, I'll put information below about how to learn more. But now, let's dive into mistake number 1, waiting for recovery instead of training for recovery. One of the biggest misconceptions I hear is, I'm just waiting for more recovery. While some spontaneous recovery occurs after a stroke, recovery is not simply something that happens to you. Recovery is something that you actively train for. Your brain has an incredible ability to adapt called neuroplasticity, which means it can actually reorganize or create new pathways or regain function after an injury. Research consistently shows that rehabilitation works by taking advantage of this ability. So think about learning a new skill. You wouldn't expect to play the piano by thinking about it, you have to practice. Stroke recovery works similarly. The more opportunities you give your brain to practice meaningful movement, the more opportunities it has to adapt and improve. This doesn't mean you should push yourself to exhaustion every day, but it means being intentional and consistent in your rehab. Recovery is rarely passive. It is an active process. Mistake number 2, doing exercises that don't match real-life goals. The second mistake is spending all of your time doing movements that don't carry over into daily life. Stroke rehab research strongly supports something called task-specific training. In simple terms, your brain gets better at doing what it practices. If your goal is to improve walking, you need to spend some time practicing walking. If your goal is getting out of a chair independently, we need to practice sit-to-stand transfers. If your goal is using your hand for everyday activities, you need opportunities to reach, grasp, manipulate objects, and use that hand during meaningful tasks. Strengthening exercises absolutely have a place in recovery, but strength alone isn't enough. The most effective programs combine strengthening with real-world movement. Mistake number 3, not getting enough repetition. This next one is huge. Most stroke survivors dramatically underestimate how much practice the brain needs to learn. Research consistently supports repetitive task practice as a key component of stroke rehab. Repetition helps reinforce neural pathways and improve motor learning. Think about how many repetitions a child performs while learning to walk. It is thousands. Yet many stroke survivors perform an exercise 5 or 10 times and assume they've done enough. The brain learns through this repetition. That doesn't mean mindlessly repeating poor movement patterns. Quality does matter, but if you're only practicing occasionally, your brain isn't receiving enough information to build stronger pathways. Consistency and repetition are often the missing ingredients. Mistake number 4, avoiding the affected side. The fourth mistake is incredibly common. It's relying almost exclusively on your stronger side. And I completely understand why this happens. The stronger arm is easier, the stronger leg feels safer, and ultimately you need to do what you need to do during the day. But over time, this can contribute to what rehabilitation professionals call learned non-use. Essentially, the brain receives fewer opportunities to practice with the affected side. Whenever it's safe and appropriate, look for the opportunities to involve the affected arm or the leg in everyday activities. Maybe that's helping stabilize an object while you open it with the stronger hand. Maybe it's using the affected leg during transfers. Maybe it's participating in reaching tasks during your daily routine. Small opportunities add up. Recovery often happens through hundreds of tiny moments throughout the day, not just during therapy sessions. Mistake number 5, believing it's too late to improve. This is one of my favorite ones to talk about because it's one of the most damaging myths in stroke recovery. I frequently hear, my stroke was a year ago, my stroke was 5 years ago, I've plateaued, here's what the research actually tells us. Recovery is typically fastest during the first months after a stroke, but improvements remain possible long after that early window. Neuroplasticity doesn't suddenly turn off at 6 months or 1 year, so consider this myth busted. I work with stroke survivors who've made meaningful gains even years after a stroke. Does that mean that everyone will make dramatic improvements? No. But it does mean that many people stop pursuing recovery long before they've reached their potential. And maybe their program just needed a boost in intensity. But progress may be slower, it may require more intentional training, but meaningful improvement does remain possible. If there is one thing I want you to take away from this video, it is this. Recovery after a stroke is not about perfection. It's about giving your brain consistent opportunities to learn. This is through repetition, through challenge and intensity, through meaningful movement, and through practice. If you've been making any of these mistakes, do not beat yourself up. Most stroke survivors have. The good news is that now you know what to do differently moving forward. In the next episode of the Stroke Recovery Roadmap series, we're going to talk about one of the most requested topics in stroke rehab, how to walk better after a stroke and the exercises I use most often in the clinic. If you found this video helpful, please give it a thumbs up, subscribe, and share it with another stroke survivor who needs encouragement. And if you'd like personalized guidance for your recovery journey, including a customized exercise program and ongoing coaching, you can learn more about my virtual stroke recovery coaching program in the description below. Remember, your stroke may have completely changed your life, but it does not define your future. Keep showing up, keep practicing, and keep moving forward.